Welcome to Dawn Dementia Care. This is a supplemental class in the Introduction to Dawn Dementia Care series. Often when I'm speaking to a group, the first question I'm asked is this: how do I know whether my loved one is developing dementia or just experiencing the memory changes that usually come with aging? In this class, I'll share with you a simple way to evaluate whether what you're seeing is normal aging or the loss of skills that dementia brings. In any case, remember, if you are concerned about yourself or a loved one, it's always wise to schedule a visit with your doctor for an assessment. First, to summarize what we learned in previous classes, we know that dementia is progressive and that we do not yet have a cure. We know that dementia eventually makes people unable to care for themselves, and we know that it's a condition that can result from a number of diseases. In the United States, it is most often caused by Alzheimer's disease. But none of these definitions help us know when we should start feeling concerned. What are the indicators that it might be wise to seek diagnosis? I look for three things: changes in memory, changes in language, and changes in attention span. Here's what I mean. Often, when I'm with my clients who have dementia, I find that they have no recollection of something we've just done together. I'm not surprised by this, because I expect my clients to lack memories as well as memory skills. At other times, however, I might be with an older friend who doesn't seem to recall something we've just done either. When that happens, I'll try to jog her memory, because I know she's getting older and it's becoming harder to bring things to mind. I expect that she can still use the skill of memory. When I jog her memory with a clue or two about what she's forgotten, it pops back into her mind. That's the difference between normal aging and dementia. With normal aging, our skill of memory still works. So if you find that when you jog a loved one's memory, they remain unable to recall the event at all, you should be concerned. Dementia also causes changes to our language skills, eventually taking away our ability to express ourselves, as well as our ability to interpret what our companions are saying. However, as we age, we find it harder to recall specific words. Usually, proper nouns go first, names, the words we typically capitalize in English. Then nouns become harder to bring to mind. I think this is because our brains get so full of information as we grow older that it's just harder to sift through it all and locate what we were looking for. But when dementia comes into the picture, words we've known our whole lives might suddenly become misattached to the meaning of a completely unrelated word. If you see this begin happening to a loved one, it is reason for concern. And finally, dementia takes away our ability to direct and maintain our own attention. We lose track of what's just happened, and so we become unable to make sense of the present. This often occurs when I'm with a client, maybe in a coffee shop or a restaurant, when there's a loud noise or something captures their attention for a moment. When my client looks back at me, I see that deer in the headlights look in her eyes. I can tell she has no idea who I am or where she is. At that point, I begin to chatter, commenting about where we are and how we came to be there and who I am and how much we enjoy our coffees together and that we come often. So if you find that a loved one is beginning to have experiences where they cannot recapture what brought them to their current circumstance or make sense of what's happening in the present, you should be concerned about dementia. Keep in mind that anosognosia may also be at work. Your loved one may also be losing self-awareness. As we discussed in earlier classes, dementia can affect the part of the brain that allows us to perceive that we are losing one or more of our cognitive skills. If anosognosia is present, the person is not being difficult. They are not in denial. They are simply becoming unable to comprehend that there are changes occurring in their own brain that affect their interactions with others and their perception of reality. As their families and companions, we need to be careful that we are not in denial about the changes they are experiencing. We need to recognize that there will be irreversible changes to their abilities, and that as they find themselves less able to function and interact in the ways they've been so accustomed to, they'll react with fear and frustration, as well they should. When someone experiences changes to their language skills and attention span, it will affect their ability to take part in conversations, and so will affect all of their interactions and relationships. And when someone experiences changes in their rational thinking skills, it will affect their ability to make good decisions, hence their ability to take care of themselves and stay safe. And when someone experiences a loss of memory and memory skills, it will affect their ability to interpret what's happening in the present. Their sense of reality will become increasingly inaccurate and different from our common reality. It's important that we, as their companions and caregivers, understand that we cannot stop or cure these losses in cognitive skills. We can only control our response to these changes, and being able to live and work comfortably with someone who's experiencing dementia comes from understanding which skills dementia will take away and which it won't. In the previous classes in the Introduction to Dawn Dementia Care, we learned which skills are kept and which are lost. Being aware of your loved one's changing abilities and disabilities is the first step in providing person-centered and strength-based dementia care. For when we repeatedly expect people to do things they cannot do, they can't help but be embarrassed and frustrated and become resentful. It's never kind to put people on the spot and set them up to fail. But that's just what we end up doing unless we understand what people with dementia can and cannot do. Person-centered care is now being recognized as not only appropriate but the kindest way to work with people who are experiencing the cognitive changes that dementia brings. When we recognize what our companions with dementia can do and pay attention to them rather than focusing on what's wrong with them, conflict and frustration can be replaced with joy and companionship. When there is less distress and misunderstanding between the caregiver and the care receiver, aging in place becomes possible. And aging in place is almost always the preferred and better option. You have now completed all the classes in the Introduction to Dawn Dementia Care series. The following 7 sets of classes will teach you how to recognize the emotional needs caused by dementia, and each set details tools and techniques that I have found so successful here at Dawn with our work with people living with dementia in their own homes. Thank you for joining me and helping me spread the good news about dementia, that we do not lose all our skills, and there is a roadmap for creating a loving and dynamic care relationship. Thank you.